For those of you that are watching, this is the most ridiculous television I have ever been a part of, but I'm following the rules. I've got my Clorox disinfectant wipes, and we're wiping down the studio because who knows who was in here over the weekend. And, that's what we're supposed to do, just like you do it at home, just like you're doing it at work. If you're back at work today, which a number of people around the state of Michigan are back at work today, and we got a new rule. And the rule says if you are at work, you got to wear one of these. So in all of my, I don't know how many years, let's see, over 40 years of broadcasting, I have never worn a bandana over my face while doing a radio or television show. I'm laughing because you got to laugh, right? But today is the first. We're doing our best to follow the rules. I'm going to hang in with a mask as long as I can because there may be there will be. Tyler will be in here. There'll be other people in the studio. So what is this you tuned into? This is not a radio broadcast, not a television show, not a cable TV show. It's not some guy from a Western movie holding up all of downtown. It looks that way on television. This is the Megacast on radio and community television outlets and across the internet all over Oakland County and anywhere else anyone wants to tune in. My name's Dave Scott at our Lakes FM studios in Greater West Bloomfield, and we thank you for watching on Civic Center TV, Channel 15 on Comcast in West Bloomfield and Channel 99 on AT&T. Now, if you happen to be in the Birmingham area, you might be watching in Birmingham area municipal access in Birmingham, Bingham Farms, Beverly Hills, and Franklin. You also are seeing this guy wearing this ridiculous bandana on television. You might also be watching on CivicCenterTV.com. CivicCenterTV.com. You can go there and get our full high-definition broadcast on the internet. Great spot to go. And then, of course, we have our terrific radio stations. 89.3 WBLD Lakes FM in the West Bloomfield, Orchard Lake, Keego, Harbor, Commerce Township area. 88.1 WBFH The Biff in Bloomfield Hills and beyond. And WAHS 89.5 Avondale Community Radio. Thank you very much for tuning in. So if you're listening on the radio, I didn't really know whether this was going to work. But in the spirit of broadcasting and in the spirit of Friday's executive order from the governor, I figured, why not? Let's try it. So yes, indeed. John Fitzgerald, the police chief in Keego, can't see me. He'd be laughing if he could because I am indeed broadcasting the show with a mask on right now. So first time ever in my radio career, but we'll give it a shot and see how it works. Busy day today. We got a lot to get to. The PPP, as we all know it now, the Paycheck Protection Plan is back in effect. Paycheck Protection Plan is back in effect. You can apply for it today through your bank. We'll talk more about some of the nuances of that. Workplaces are opening up. Additional workplaces are opening up, and that means you got to wear your mask. So that's what we're doing. Tyler's in the studio now. What do you got? What are you styling over there, Tyler? Let me get your microphone on.
Let's get that on. I'm in the same thing you're in. I'm in a bandana, just a different color, but same situation. And just like you, first time in my broadcast career I've ever been on the air with a bandana on my face.
I know. It is a little funny. Now, you sound a little more muffled, because I don't think I sound too muffled on mine. But you sound a little more muffled on your bandana.
Maybe.
Maybe you can loosen it up around your nose a little bit. I want to make sure you get the good coronavirus protection going on there. Budget crisis, nothing to laugh about today, and really none of this is anything to laugh about. I just want to be clear. We're doing what we can to keep everybody safe. There's a budget crisis in the state of Michigan. We know that Lansing is having to deal with it. It is going to start to affect our local communities. We see in the news today that Livonia has furloughed. Livonia has furloughed 37% of their employees. And I can only imagine, we'll talk to folks in our Oakland County communities over the next couple of days, but I can only imagine that situation is going to be very similar in Oakland County. Survey out in Cranes today says 29% of the employees statewide are furloughed. That's not a specific number from the state of Michigan, but that is a survey that went out. And then I got one crazy story to tell you about, and then we'll get to We'll get to Chief Fitzgerald here in a minute. Chief, good morning, by the way. Do you mind hanging in there just one more minute for us, Chief?
No problem, Dave. Good morning.
Good morning. I've got just one more quick story that, Tyler, this one kind of surprised me. So, just to be honest and direct, for people watching, I've been putting a lot of hair gel in because my hair is really long. We've not been able to get our hair cut, okay? And I know your hair is getting pretty long over there. And so we haven't been able to do it. So then I'm talking to one of my friends over the weekend, and I just asked them what's going on and how they're doing in their house. And I asked them, well, how's their dog doing? I thought it was kind of cute because their dog is named Steve, which I think is funny already. But I asked them, so how's the dog doing? And they said, well, the dog's doing pretty good. We're taking the dog to get groomed next week. I said, wait a minute. You're taking your dog to get groomed. You can get your dog groomed under the current rules, but Tyler, I can't get my hair cut, but their dog can get their hair cut. And then so I said, well, how is that possible? Well, we go to the vet, and we do a curbside drop-off of Steve, in this case, of their pet. They drop it off at the vet, and then they come back a couple hours later, and Steve's right out there on the curb. They pick up Steve, and they got Steve all trimmed up nice and pretty. So I don't want to make light of all this. This is a serious matter, but it just lets you know by example, and it's kind of the theme of the show today, as we get ready for another press conference from the governor at 4 o'clock, that it ain't easy, babe, as the song said, and it's not easy to delineate all of these different situations that affect every aspect of our life. As my glasses fog up with a mask, it isn't easy to get all this worked out. We have broadcasters in masks. We have dog grooming going on. And then if you're a boater in Oakland County, I'm not so sure. Even though we can now put motorboats in the water, we are going to try to figure out before today is over, and if not today, tomorrow, to try to figure out if you can actually have, the place that you store your boat, if they can come launch your boat for you. Because, I don't know how all this is going to work out. So as confusing as it is for us, it must be even more confusing and difficult for John Fitzgerald. He is the chief of police in Keego Harbor, very patiently waiting for us through all this. Chief Fitzgerald, I'm sorry. It's Monday. I've had a little bit too much coffee, but we're being a little silly. But it isn't easy figuring out our way through all these things, is it?
No, it's not. But you've got a lot of great questions, a lot of great information going out. So I'm happy to wait for you to get done with it.
Well, thank you. We just wanted an opportunity to say good morning. So we did hear some a report today, Chief, from the Attorney General that said, we understand there's a new rule about face masks in the workplace, but if employers can't comply, because the new rule says you have to, if you're an employer, you have to provide face masks to your employees. Attorney General said that we may not be able to get to that for a couple of days, and cutting some slack to law enforcement like you around the state to give you a little bit of leeway to enforce that or not enforce that, and it just another challenge local police departments are having. How's it going with that one? Have you encountered that issue and anything else you're running into, Chief?
We haven't encountered that one yet. It's brand new. It started up either this weekend or today. And of course, we have our PPE masks here too. I'm in my own office, separated from anybody else here. That's why I don't have mine on, but I did wear mine this weekend when I went out to the store. I had to go to the hardware store and the auto parts store and wore mine in. Everybody should remember too that whether it's a law or not, when the store puts a sign on the window that says you have to have one to come in, that's their right to keep you out if you don't have a mask. So don't try to buck the system that way.
No, there's a lot of different ways you can cheat the system, and that's why I'm wearing my mask today, because it's a little uncomfortable. It's a little hot, really, actually, wearing the bandana. But let's try and do what we can to follow the rules. And you're right. We've been talking about face masks in the workplace, but really maybe the biggest impact is people going to the stores. And I don't know about you, Chief, but I was out this weekend I had a little shopping to do, and everybody that I saw going to the grocery store, they all had their face mask on. It was great.
That's what I saw. Was most people had it on. Like I said, I actually wore mine this weekend. If you don't have a face mask, you can still use bandana. You can use a scarf. That'll be kind of warm too. But anything to cover it up to keep you from expelling stuff out of your lungs towards other people. And I believe the order said that there wasn't an actual fine to go along with this, but so that makes it hard to enforce anything police-wise on it.
Yeah, they said that there is no fine if for the face masks in the store, but I'm not so sure that there is not enforcement. In fact, I think there is some enforcement protocol for businesses if they don't get face masks to their employees. But we were able to buy these bandanas. We bought them last week at I just found them at 7-Eleven, to be honest. But you can get some of this stuff, and now the retail stores are doing curbside, and you probably can get some bandanas or other face stuff. And there's a lot of options out there. But employers are supposed to, starting today, provide, if you have employees coming in, provide face masks. So I know people will do the best they can to comply. Keego Harbor, plenty of lakes in Keego Harbor. How are we doing on the waterways? Did you see anybody getting out and exercising their opportunity to use their powerboat over the weekend?
There's been a few, no reports any problems with it. It's still kind of a little chilly out there for some people to get out. I know that everybody's anxious to get going with boating season all over Michigan, and they will be out on Cass Lake and Sylvan Lake, I'm sure very soon, but we've had no reported problems.
Chief, we had a little noise there. I just turned you down for just 1 second. What else is going on? I mean, other issues that you're running into, any other updates that you might have for viewers in Keego Harbor and around the area today?
A couple of issues took care of themselves with the latest updates to the executive orders. We can now have some of the lawn maintenance people come out as long as they maintain their social distancing. That's great. There was a lot of complaints about people weren't going to be able to get their yards cut, but now people are allowed to do that. People are doing a good job of social distancing. I'm happy to say that at Keego Harbor, we have luckily in our department and in our city employee workforce not had to worry about a case of the coronavirus. Knock on wood. Let's hope that stays that way. But our zip code area has been pretty it got pretty low numbers overall in the 48320 for corona infection. So we're happy with all that.
Well, no, the numbers have been low in some of our areas, very high in some other places in Oakland County. But we did see, and we'll get to the numbers today, we are continuing to see an improvement in the numbers for the most part. It's still so tragic when you see these numbers and you hear about the terrible numbers of deaths that we're still having in our area. But the curve is definitely flattening, and we are seeing fewer and fewer coronavirus cases. Have you or your officers taken advantage of the opportunity to go and get tests in Oakland County? The new rules and the new testing allows for any first responder that wants to get a test to go get it.
So far, nobody has taken advantage of that yet because nobody's had any symptoms to worry about. We had one person that we quarantined away for a couple of weeks because he was in contact with somebody else that tested positive, but he's back and exhibited no symptoms. So we haven't anybody that's had to take advantage of the testing yet.
All right. Well, Chief, anything else you want to add from Keego Harbor?
I just want to say, look outside. What a great looking day out there. Get out, go for a walk, enjoy the fresh air, and thanks for checking in with Keego Harbor. We appreciate the opportunity to talk to you, Dave.
All right, Chief, thank you very much. Appreciate you being on with us. He is the Chief of Keego Harbor Police Department. It is Chief John Fitzgerald. Dave Scott here in the Megacast. If I sound a little muffled, it's because I am actually wearing my mask. Tyler's in the studio. We're doing the best we can to comply with the rules. He is 6 feet away. You are 6 feet away, but stay on your side. But even so, we're trying to do what we can here. Coming up, we got a great show lined up. By the way, we're going to talk to our favorite doctor, Dr. Jamie Taweel, will join us. He is an internal medicine specialist right here in our area, and we'll get an update, Tyler, on exactly what's going on with the coronavirus, and talk about physicians in our area, especially pediatrician offices in Michigan, and what's going on with vaccinations. If it's just one of those other things that hasn't been happening routinely, and if your children are missing their vaccination protocols, that's not really good. It's that and other elective surgeries and other things that should be going on that people have not been getting on. And then what about all this stuff that came out of it? I mean, I think the media made a bigger deal out of it than it actually was, Tyler, but all of this stuff about using household cleaners to treat ourselves, clearly, that is not something we want to do.
No, and if you're going to use household cleaners, use them to clean your house, but use them safely.
Right.
Pretty
And
simple.
we heard even another story a couple of weeks ago, people that were concerned, poison centers concerned that people were, pulling things out of the garage to clean their house with. They really shouldn't be using. So we'll talk a little bit more about that with Dr. Taweel, who's getting hooked up right now. Hey, guess what? It was a football draft over the weekend, and I cannot believe this guy's going to join us. I am so thrilled. Dan Miller, sports director at Fox 2 Detroit, and our play-by-play host of the Detroit Lions will join us after 11 o'clock, and we'll have a little shift in our program here and talk sports. I think we deserve that. What do you think?
Absolutely. It would be great to talk some sports.
So, Dan Miller, as soon as he gets on the air, I'm going to ask him how he's coping, not only with the coronavirus, but with being the play-by-play guy of the Lions. I mean, it's hard enough on all of us over the years having to deal with the lack of success of the Lions. Tyler, you and I broadcast high school football together. Can you imagine having to go in year after year? And, and he's a good guy, and he's always so upbeat. But, at some point, don't you think you get a little bit down in the dumps after trying to make, lemonade out of lemons for so long?
No, I'm down in the dumps just as a Lions fan from trying to do that. So let alone a broadcaster where it's your job and it's your duty to stay positive and stay neutral. Oh, man, I can't imagine it.
So on the coronavirus front today, the headlines that we're watching, the PPP, the Paycheck Protection Program that was refunded by Congress, is now back in action. Federal government saying today that they're putting a $60 billion cap on banks. So banks that were able to get a lot of loans out, some of the really big national banks that were able to get a lot of loans out, may be capped. So as you're going for your PPP loan, might be a good idea to talk to some of the smaller community banks. Whatever you do not hesitate. Get out today and take advantage of that money while it is still available. Businesses have their hands full getting prepared for the updated rulings from the governor on Friday. We had her press conference on the show. Employers must make masks available to people who are at work. We're wearing ours today, and that's going to be making headlines. Wearing the masks into the stores is important. You got to do that. I could just tell you that a lot of people are wearing those. That's really good news. We're going to talk a little bit more later on in the program about the budget crisis in Lansing. And we talked to one of our state representatives here on the show coming up later on. We check in, I believe we are checking in today with Ryan Berman, State Representative Ryan Berman, joining us on the program. And, what aid will Lansing have for our communities, and how are they just going to get through this budget crisis in the state of Michigan? Where's the federal government going to come in and play a role? Livonia made news today, and this is, I'm sure, going to be the case with the communities that are in our area, and we're going to try to talk to them about this very sensitive matter over the next couple of days, but making it easy for us so I don't have to ask Steve Kaplan this question today. Livonia has announced they are furloughing 37% of their employees. Will we see that carry on through to our local municipalities and school districts? We talked to Dr. Schwartz in Avondale on Friday, and he was pretty honest. He said school districts are going to be facing cuts, and one of the biggest expense categories there are their employees, so expect more on that. Tyler, we know that the unemployment numbers here in the state of Michigan are huge, but a new survey in Crane said 29% of employees, 29% of all employees in the state of Michigan have been furloughed. That's a huge number.
It is, and it's good in the sense to know that their jobs will likely be there when they come back. At this current juncture, we can't say for sure, but it's still 29% of people that are out of work at the moment and being furloughed, and that's just a sign of the times, and it's awful.
And congratulations to retail today. So retail is back open. We're going to get some retailers on the line. I figured they were a little busy this morning. We're going to give them a day to get it together, and then we'll get some retailers on tomorrow. But on the retail front, it should be a lot better today. You can go to your local store. Most of the facilities will be open. They'll be doing curbside ordering. So you might want to call the store that you want to go to. So I have run out of some things for my bathroom. I was thinking, Bed Bath & Beyond. You know, they're kind of expensive, but they got all the really nice stuff over there. I like that really nice soap they have there. So what do I do, Tyler? Do I get on the phone and call them? Or I assume that's what we're going to do. So you call your retailer, you give them the credit card over the phone, and then you go by, and there's your stuff on the curb. I assume that's what's going to happen.
It's going to be a lot of calling. It's going to be a lot of online ordering. And I think that's where it's going to be going for the foreseeable future.
So we will talk to some of the retailers in the area coming up in a little bit, and then of course the big box retailers. They're really in the driver's seat because they have food. Now they're going to be able to also provide all the other services they have there. That may be the easy go-to place for a lot of people if you're willing to walk into those stores. Now, the new ruling says they have to make sure that they're limiting the number of the people in the stores, and they also have to create hours for people that are over 60 and for people that also may have some immune deficiency or other issues, and they don't want to be in the store in general. So those new rules, Governor continued to issue executive order after executive order over the weekend, refining some of the things missed in Friday's executive order. A lot of it is deep in the weeds. We won't get to it today. The one I've been looking forward to that I think affects us in a huge way in Oakland County, in our lakes areas, what about boating? So the and it's going to be really nice this weekend, too, where temperatures are going to be up in the 70s. So what about boating? So you can run your power boat, but an awful lot of people have their power boats stored at a marina, and they need help to get their boat launched. It's not necessarily for many of us sitting in our backyard in a trailer, and we could just launch it. And I didn't see any clarity as to whether those businesses can open. And I looked nonstop all weekend online to try to find out. So our producers are hard at work making that happen and see if we can get a hold of a marina. They're also chasing down some landscapers, and golf courses are open. So we're going to try to talk to some of those folks. Again, Dan Miller joins us from Fox 2. He is the Detroit Lions play-by-play announcer. We're going to talk about that amazing Detroit Lions draft. And will football return? State Representative Ryan Berman joins us. We'll talk about some of the budget issues. And then an area lawyer, Sabrina Cronin of the Cronin Law Firm, joins us. So many different areas we can get into with her later on. But right now, checking in as he does so well and so patiently waiting, is our good friend, Dr. Jamie Taweel. I'm glad you're not billing me by the hour because I just left you. Actually, it felt kind of good, Tyler. I got to leave a doctor sitting in my waiting room for a couple of minutes. When's that ever? when does that ever happen?
Enjoy it while you can.
Oh, Doc, I wish you could see us right now. We don't have our setup here, so we can see you, but you can't see us. And I look pretty sexy in my red bandana today, I got to say. So
very nice.
Does it sound okay? Can you hear me all right?
Yeah, I can hear you just fine. How about myself?
Yeah, no, you sound really good. So Governor's executive order over the weekend, it was actually Friday afternoons, got us all wearing masks. Any thoughts about these cloth masks, the masks we're making? Any thoughts, recommendations from you, Doc?
Yeah, you're ultimately going to want the mask to limit the amount of transference of this, potentially dangerous virus. So what I want you to do is make sure that the mask is going to be thick enough to, really restrict some of that air. I don't want you to, don't want you to choke yourselves by any means. I guess there was a makeshift rule of thumb that if you can blow a candle out the mask, from about a foot distance, I think that the mask is not working well enough. So you want something to be that's going to try and prevent some significant transference of air, but obviously you don't want to be choking to death. The more you can get it to fit around your face, you don't want it to kind of billow out on the sides where air can come and go. Anything that does have a little metal bar that can allow you to try and pinch around the nose, these things aren't requirements. Of course, anything you can do is going to be in a bit of an improvement. However, whatever you can do to try and improve those numbers, the better off you're going to be.
So, I went simple, Doc. I hope I did okay. I've gone with a folded over bandana, pure gangster, pure Western style here. And
rob a stagecoach.
It seems to be working pretty good. It's really tight. I got a really good knot on the back. It's covering my nose and my mouth. Do we have a candle here, Tyler? We could do the candle test? All right. Well, we'll see if we can find a candle here. I don't know if we've got one here in the studio. But it's got things covered up pretty good. I mean, is that, at least I'm trying, at least I'm trying. What do you think?
Yeah, no, you are improving your chances and your risk significantly. So I encourage you to do that. I mean, a cloth mask is still a very reasonable way to address this. Not everyone's going to be able to get medical grade N95s or KN95 masks. And even if they do, most of the time, they're not going to fit them appropriately.
Yeah, no.
I do think that the cloth masks are very beneficial. I do not want to downplay the importance of wearing any type of mask. Anything is better than nothing. Let me just repeat that. Anything is better than nothing.
So, and the rules say you're going to wear the mask when you go to the store. You're going to wear the mask whenever you go in any enclosed environment. And you might as well I keep a couple of these bandanas in my car now. And I take it off when I'm driving. But as soon as I get out of the car, I put it right back on. And anytime I go anywhere, then we go with a mask. So, this is what we're going to do for a while. We'll see how it works. Hopefully it helps. If nothing else, it's the law. And we're not going to go to jail if we walk into a store without one, but the stores can kick you right back out if you walk in without one. So, why not try it? And employers, you have to have masks available for your employees. So, thanks for the candle tip. I like that, Dr. Taweel. We'll try that one later on and see how we're doing. And no one should be wearing those N95 masks really running around in the public, right?
Well, I mean, if they have them, of course, they can wear them, obviously, but I think the KN95 masks and the N95 masks are, more importantly, best reserved for healthcare workers who are actually dealing with known cases, to try and reduce their risk as much as possible and make sure that they have them fitted appropriately.
So can I tell you a story? Because we just like to bring this right down to grassroots level. So I'm on the phone with a friend of mine over the weekend, and their daughter, West Bloomfield resident, their daughter gets a fever over 100. It was like up to 101. So they sent her off in the car because they wanted to stay isolated. She was able to drive. Went over to Henry Ford Hospital. There wasn't really much of a line. She was tested. They're waiting for the results. Shouldn't be much longer than a day or two these days to get the results back, and then they'll know. But if you've got somebody in your house that's got symptoms, should you try to isolate from them? What do you do?
You have to. You have to do the best that you can. So if someone does have symptoms, they have fevers, you want them to at least remain self-quarantined from the public. In the house, you're going to try and do the best you can. You're going to do hand washing. You're going to try and wear the mask. Obviously, the person that has the symptoms should wear the mask as well if she's going, if that person's going to interact with people. Continue to use, precautions, hand washing, try to maintain 6 feet of distance. If you do have to interact closer with family members, if you have a child that's going to require your care, you're going to do the best you can. You're going to wear the mask, hopefully encourage the child to wear the mask. You're going to wash your hands before and after, and you're going to keep continuing to try and mitigate this spread as best you can. I do recommend also, if you are touching things, opening doors in public, just kind of a side note, try to use your non-dominant hand, because the dominant hand, if you're going to touch your face, 9 times out of 10, you're going to use your dominant hand. So if you're going to touch public things without realizing it, try to use your non-dominant hand so that you can avoid trying to inadvertently, create more spread.
There's just another really useful tip I never thought about. I've never heard anybody say that. Where'd that one come from? That's a great idea.
It's what happens, just kind of as if also washing hands, make sure you're getting the thumb on your dominant hand, because you tend to avoid doing that when you're washing your hands as well. So things like that. I'm trying to just make sure that everyone's getting a little bit more data.
I like that. In fact, I just added the term, Tyler, non-dominant hand to our Corona-19 vocabulary list. Because when would you have ever said non-dominant hand up until this crisis?
Yes.
So,
you're right-handed, tend to use your left hand to open things and touch things if you can, because you oftentimes use the hand if you're right-handed, you tend to touch yourself with your right hand.
No, and it's so hard. In fact, even the governor, when she was talking about not touching her face, and she admitted it touched her face, it's one of the hardest things to do, to keep your hands away from your nose and your ears and your eyes and all that. It's difficult.
I just did that while we were talking. So.
It's really hard to do. So I like that. Use your non-dominant hand for touching things. I have this little routine when I go to the restroom where I take the towel and I wipe things off, and then I use the towel to open the door, and then I throw the towel away. So in case, somebody else touched the handle on the way in, hopefully we would be okay. So best of luck to my friend whose daughter has the fever. Certainly taking medications to reduce fever, that would be okay. And we want to take Tylenol right now, not ibuprofen. Is that correct?
Yes, ibuprofen is something that has been showing to help actually propagate this virus a little bit better. If you do have it and you take ibuprofen, it can actually make things a little bit worse. As some of the data that's coming out, it upregulates. It is what's called an non-steroidal, so it can increase certain amounts of a particular enzyme that the virus uses to propagate. So try to use Tylenol to reduce the fever as best you can, rather than ibuprofen, Aleve, Motrin, things along those lines. Naproxen, another one of those.
Dr. Jamie Taweel is with us, internal medicine specialist right here in the Lakes area, and he's been our local go-to doc during the coronavirus. We appreciate it. Clearly, I'm not even going to get into the injecting Clorox into our veins issue, because that's just such a ridiculous concept that I think everybody knows, not to do. I mean, I hope everybody knows not to do that. On the positive side, we did hear over the weekend and through press conferences on Thursday and Friday that that treatments at our hospitals for COVID-19 patients are getting better. The physicians in the ERs and in the intensive care, they're learning, they're finding things out, and they're sharing that information. Are you hearing the same thing?
Yeah, I think physicians are it's been wonderful. I mean, every hospital system that I'm a part of sends me routine emails with data, all of the amount of cases that they have, things that they're doing, as well as I'm getting New England Journal articles sent to me. Physicians are talking. The medical community in and of itself has become amazing in the sense that they are just all converging and really sharing ideas and doing what works. And this is organic. It's moving wonderfully along with how everyone's interacting, and healthcare systems are working together, and it's actually been pretty inspiring more than anything else.
Well, and one of the things that I just felt better about after hearing is that we are much further along, even if we don't have a specific medications right now for treatment, just the way we're handling patients. Like I heard one thing about doctors putting patients on their stomach rather than on their back, and then they've had much better results. So little things like that are making a big difference to the patients that we're treating. And we're getting better results. Every day, the physicians learn more. And I'm really glad to hear that you're all communicating with each other and sharing this information. And we're a lot further down the road now than we were a couple of weeks ago.
Very, very true. And Michigan does have a high rate of infected healthcare workers, which is unfortunate. But I think we're starting to realize that there's more danger out there. And so the fact that they're sharing ideas and getting a little bit more proactive, I think, is wonderful. And so anything that's new that's coming out, believe me, it's getting spread. So that's a good thing. So not just bad things that are spreading.
Dr. Taweel, anything else you want to add before we say so long? I don't want to occupy your whole day, but I appreciate you checking in with us.
Anytime, and I appreciate it. No, just stay safe out there. Please be careful. Wash your hands.
All right, wash your hands and use your non-dominant hand, everybody, to open that door. That's the tip of the day. I like that. Use your non-dominant hand to open the door. Less likely that you're going to take that hand and touch your face with it. Very good tip. Thank you, Doctor.
Be well.
You too. Be well. He is Dr. Jamie Taweel joining us here on the show. Dave Scott, Tyler Keefe. This is the Megacast. We are masked up. We're going to stay here for. I think I might be able to make it through the show. I think as long as you're in the studio, I'll stay masked up. If you have to step out, we'll unmask here, but we appreciate it. We're going to take a quick break. We'll be back in a couple of minutes. Thanks to our radio stations across our coverage area, WAHS 89.5 Avondale Community Radio, 88.1 WBFH, The Biff, and 89.3 Lakes FM. Our television outlets today are Civic Center TV, Channel 15 on Comcast, and then Birmingham Area Municipal Access, Channel 15 on Comcast in their communities, which are Birmingham, Bingham Farms, Beverly Hills and Franklin, you could tune in there on Channel 15. Do the same on Civic Center TV in West Bloomfield, Orchard Lake, Keego Harbor, Sylvan Lake. Anywhere else in Metro Detroit, if you're an AT&T subscriber, go to Channel 99, and you'll find the community channels in there, and select the West Bloomfield channel, and you'll be able to see our broadcast in video. Make it easier. Go online at civiccentertv.com, and that's where we are. And a big thank you today to ourselves. We are our own Facebook partner today, so you can go to the civiccentertv.com Facebook page and see our live stream there. We're going to take a quick break, and we'll be right back.
I know you're concerned about the coronavirus, and we're working hard to combat its spread and keep your family safe. But we need your help, too. Wash your hands often with soap for at least 20 seconds. Avoid touching your face and cough into your sleeve. Replace handshakes with an elbow bump. Avoid large crowds or events, and if you're sick, stay home and call your health provider. Every one of us can make a difference limiting the virus's spread and keeping Michigan healthy.
Hi, I'm Dr. Jonae Khaldun. I'm the Chief Medical Executive for the Michigan Department of Health and Human Services. The people who are at highest risk of getting severely ill from COVID-19 are the elderly and those with chronic medical conditions. That includes people with heart disease, diabetes, COPD, or those who have compromised immune systems. People who are in those categories should right now be staying at home as much as possible and not going out if it is not essential. If you fit into one of those categories, those are the things you should do. And if you have a family member who fits into one of those categories, you should be checking in on them and making sure they are following those guidelines. There's something everyone can do to protect the community from COVID-19.
Hello, I'm Dr. Faust, Medical Director for the Oakland County Health Division. Coronavirus disease 2019, or COVID-19, is a new disease caused by a new respiratory virus named SARS-CoV-2. COVID-19 was first identified in December 2019. There is currently no vaccine to prevent coronavirus disease 2019. The best way to prevent illness is to avoid being exposed to this virus. Wash your hands often with soap and water for at least 20 seconds, especially after going to the bathroom, before eating, and after blowing your nose, coughing, or sneezing. Clean and disinfect frequently touched objects and surfaces using a regular household cleaning spray or wipe. Avoid close contact with people who are sick, and avoid touching your eyes, your nose, your mouth. Cover your cough or sneeze with a tissue, then throw the tissue in the trash. Finally, stay home when you're sick. For more information about coronavirus disease 2019, go to oakgov.com/health or call 1-800-848-5533.
Welcome back to the Megacast. Dave Scott, Tyler Keefe. We thank you very much for joining us here on the program today. Awful good to have you here. We will be talking to Dan Miller of the Detroit Lions and Fox 2 Detroit. I think, Tyler, if I have all this information correct in front of me, I think Dan has been, let me hit one more button here. I think Dan has been broadcasting from home for the most part. I don't know if you've been catching his broadcast on Fox 2.
Very often caught the
I've been pretty impressed. Most of the TV stations have been doing a good job getting their people at home. I don't know why can't I do this show from home? I mean,
Sure you're good.
So we have this new order from the governor. It came out on Friday. And in case you missed her press conference on Friday, I thought I would play for you the governor telling us about the new order. Let's listen in and watch, if you're on Civic Center TV and our other TV outlets, what the governor had to say on Friday.
I signed an executive order this morning to extend the stay home, stay safe order through May 15th. The data shows that most Michiganders are doing their part by staying home and staying safe. It's good, but we must keep it up. The order I signed today requires that everyone wear a covering over their nose and mouth, like a homemade mask or scarf or bandana or handkerchief, when they are in an enclosed public space. To be clear, when you go to the grocery store or to the pharmacy or to any store that's open during this time, you need to wear a face mask. If you're in an outdoor area, this order doesn't require that you wear one, but you should consider it anyway. And regardless, you need to observe the 6 feet radius of safety so that you are protected from spread. Masks worn in the public, masks worn by the general public, should be cloth, non-medical grade masks. We need to save those medical grade masks for our first responders, people on the front line. Under the order, no one will be subject to criminal penalty for going without a mask, but a face covering is crucial to protecting the public and our critical employees. And for now, N95 masks need to be reserved for those on the front lines. In addition, all businesses must provide non-medical grade masks and face coverings to their employees who work outside the home. We need to protect our workers. While this order is extended to May 15th, I am lifting some of the restrictions. The new executive order will now allow some workers who perform lower risk activities to go back on the job. We will consider this the preliminary stage of economic re-engagement.
So those are the words of the governor yesterday, actually on Friday, sharing with us her executive order. And, the big deal, I mean, the biggest thing that impacts more of us than anything on Friday was this whole mask thing. Make sure you have your mask. Employers, make sure you have a mask as well available for all of your employees. And let's do our part, everybody. Of course, golf is opening up again today. You can have a landscape at your house today. That's all good news. And boating, power boating is back. I'm not quite sure if you can get any help getting your power boat launched, but power boating has returned to the state of Michigan. That is really good news. We're going to talk a little later on in the show with State Representative Ryan Berman and try to get some idea how we are doing with our budget situation here in the state. We're beginning to see local municipalities around the state of Michigan suffering already from this whole crisis economically. And where is all this going to lead from an economic standpoint? Livonia already announced that they are going to be laying off, I think they said 37% of their workforce. So this is obviously a challenge for communities, and we'll find out more about what's going on in our communities here in our coverage area, certainly over the next couple of days. Go to our Civic Center TV website. You can go to our coronavirus page, and there you will find the biggest news stories of the day. And in addition to what we were talking about, new COVID-19 protocols at grocery stores. If you're unclear of the whole mask policy, there's a complete update on that at civiccentertv.com/coronavirus. Michigan reports 41 new coronavirus deaths, and that is a terrible number and a tragedy related to every one of those 41 people. However, on the good side, it is the lowest number since the 29th of March. Michigan reported the lowest number of deaths from complications with COVID-19 since March 29th on Sunday. The number of new positive cases saw a rise. However, that is being largely attributed to expanded testing. We're doing more testing now than anywhere. So that overall is good news. Certainly tragic deaths, but we seem to be moving in the right direction. Following up on the headlines of the day, executive order extended to protect jails and juvenile detention populations. Governor Whitmer signed an executive order on Sunday that extends COVID-19 protections for vulnerable inmates at juvenile detention centers and jails and local lockups, and all the information is available on our website. And here's an interesting story. We're finally beginning to see our universities weigh in and what their plans may look like for the fall. Oakland University unveils their fall plan: masks, tests, and some campus classes. So whether you're going to Oakland University or not, really a good idea to read that story, see how the plans are coming together. And we talked to the folks in the Oakland University admissions department last week, and I believe tomorrow, Tyler, we're going to talk to the folks from Oakland University and find out about e-sports going on there. They actually initiated an e-sports program at Oakland University. And I know very little about e-sports, but we're looking forward to learning more about that when we talk to them tomorrow.
Yeah, it's a growing community. It's a growing competition throughout the country, throughout the world, and it's interesting to see now that these college schools and these even some high school programs throughout the country are picking up on it and joining in.
Taking a look at one more issue of concern for you if you have young children at home, story you might want to look at today at civiccentertv.com/coronavirus. Coronavirus empties pediatrician offices in Michigan and decreases vaccinations. Story reads on, parents have proceeded with great caution in taking their children to doctors' offices throughout Michigan while telemedicine visits have gone up. COVID-19 has kept office visits to a minimum, and they have been in a decline. This includes a decline in the number of parents getting their children vaccinated. Visits to the pediatrician's office are down 70 to 80%, according to the American Academy of Pediatrics. And, you know, it's another one of these effects. The elective surgery, the other just maintenance things that people aren't doing. We talked to a number of doctors over the past couple of weeks, and it can be really tragic, Tyler, because somebody might have some medical condition. They normally would go in and get a treatment or get a test, and maybe they're not going in and doing that right now.
Yeah, and that's definitely going to affect them, if especially depending on the severity of their condition. Talk about pediatric medicine, young children getting their initial shots, and that delays that, and how does that affect them now and down the road? So it is a dangerous situation well and beyond just treating the virus.
And one other thing I advise you to do if you've not done so, it's informative and will help you understand the impact of COVID-19 right in your front yard, is to go to our Civic Center TV website and either go to the Oakland County Health Department link right at the top of the coronavirus page, or go to the stories today. There's a direct link to the Oakland County percentage of cases by zip code map. And this is showing positive cases per 10,000 people in Oakland County. And you can look at the map. And Tyler, when they first released this map several weeks ago, we looked at the map, and there were only certain areas in our coverage area here in Oakland County that had the most number of cases in the dark, and they're displayed now. You can see it on the map, and I'll zoom in a little bit here. You can see these communities displayed, if I can get them all in there. There we go. You can see these communities displayed in the darkest of blue. And as you get out to some of the outlying communities, it makes more sense. White Lake, Highland, Milford, Oakland Township, Independence, and Clarkston. Waterford in the darker blue, but now in the darkest blue, the highest percentage of people with the coronavirus. We see many of our primary communities where you listening right now live, and that includes Pontiac, that includes West Bloomfield, Orchard Lake, Sylvan Lake, and Keego Harbor in the lighter blue right now, but Bloomfield, Bloomfield Hills, Franklin, Southfield, Farmington Hills, Lathrop Village, all in the areas with the highest concentration. Birmingham a little bit better off, and some Bloomfield Township a little bit better off. Troy a little bit better off. But it's really a fascinating tool to go look at, and if you want some information to maybe motivate you to stay home, to stay safe, to get these bandanas on like Tyler and I are doing today, or whatever other face covering you're going to come up with, good idea to go out and get that done, especially if you're in one of these communities that is most impacted. One more real quick at the headlines, and then we're going to take a break, and we'll be back in a couple of minutes. I'm really, really excited that Dan Miller has taken some time to join us today. He's the sports director at Fox 2 Detroit and the play-by-play voice of the Detroit Lions. So you need a little break from all this, and the NFL draft over the weekend certainly was that. Tyler, did you get a chance to watch that at all?
Yeah, I watched a lot of the draft. I watched the first round, of course, last week, Thursday, and the second and so on rounds on Friday. I watched a little bit of it over the weekend, but pretty much at that point stuck to the teams and the players that I'm most interested in.
So it was weird. It definitely was unusual watching the way they did it. They were supposed to do it in Vegas. They ended up doing it at the ESPN headquarters, and it was odd, but they said the viewership was higher than ever. It was the most watched NFL draft in the history of the draft. More people tuned in, and it's the first live sporting event of any kind that we've had, or at least the first live, I don't know if you can call the draft a sporting event, but you know what I mean. First live sporting activity on television in months, so all of the sports-starved people were tuning in, but record numbers, and as Dan Miller will, I think, tell us, and we talked to him in a couple of minutes, went pretty well for the Detroit Lions.
Yeah, I think that on the viewership angle, people were interested to see how it would work, if it would work. It was interesting to see people in their homes, the coaches, the GMs operating these teams. People love their football, and when they have a chance to look into the future of their teams and the players that they followed throughout the college journey of those players, the interest is going to be there. But it is going to be interesting to see where does everything kind of go from here, because we're at the point in time where we're a couple months away from NFL training camps. We're at the point now where the NBA playoffs would have already started. They would have started, I believe, last Saturday. And it's an interesting time in sports because we're looking back at the history and we're looking back at some of the great athletes, the great teams, and so on. But the big events now have just been the little things like the NFL draft. It's usually a big event for football fans. It's now a big event for all of sports and everyone and all these sports fans. And the Last Dance documentary about the '98 Chicago Bulls. It's another one where it's a sporting event now because that's all we're getting.
I got to tell you, though, I did yesterday, and we'll get to break here and get back to coronavirus, but I did yesterday enjoy watching the Green Bay New England Super Bowl, and Brett Favre was in there as quarterback, and it was really good to hear Pat Summerall doing the play-by-play and John Madden doing the color. I mean, it was a great broadcast. So a lot of fun watching Green Bay win that big Super Bowl way back when. We're going to take a break. We'll be back in a couple of minutes. Again, coming up on the show, we're going to talk to Representative Ryan Berman, 39th District, and so much to find out about what's going on in Lansing. We've not heard from any of the folks on the Republican side of the aisle since the governor passed her updated stay home, stay safe. They passed a resolution in the House trying to restrict the governor from putting in further restrictions, and of course that would have needed her signature. It isn't going to get it. So we'll talk about that. We'll talk about primarily our impending budget crisis here in the state of Michigan and how that is all going to work and what impact that may have on you, on our local communities, on our local school districts, and much more. So it is our special coverage of the coronavirus in Oakland County. I'm Dave Scott, Tyler Keefe here, and we are on WAHS 89.5 Avondale Community Radio, 88.1 WBFH The Biff, 89.3 Lakes FM, Civic Center TV, Bloomfield Area Municipal Access Television, and today on the Civic Center TV Facebook page. Thank you for tuning in. We'll be right back.
Hi, I'm Dr. Jonay Khaldun. We know that COVID-19 is spreading rapidly across Michigan right now. The most important thing people can do to protect themselves is social distancing. That means unless you are a critical infrastructure worker or going out to get food or medicine for your home, you should be staying at home. Stay home, stay safe, save lives.
Hi, my name is Kurt Lawson, and I'm the Public Information Officer for West Bloomfield Township. We wanted to reach out to you, our older adults, to provide information that you may find useful during this difficult time. We want to ensure you that West Bloomfield Town Hall, our Waters and Utility Department, West Bloomfield Parks, and our police and fire departments continue to work hard on your behalf. Information and resources can be found on the Township website, the police Facebook and Twitter, or call West Bloomfield Park's COVID-19 Help Hotline. Please remember to keep your social distance of at least 6 feet, wear facial coverings when you leave your home, and wash your hands for at least 20 seconds with soap. These precautions will help keep you safe during these difficult times. Welcome back to the Megacast here on 89.3 Lakes FM.
WBFH 88.1, WAHS 89.5, Avondale Community Radio. We thank you so much for being with us on these three great radio stations across Oakland County. Also, thank you to Birmingham Area Municipal Access TV, West Bloomfield Area Municipal Access TV, a bunch of Facebook Live pages, and on our website at civiccentertv.com. I'm Dave Scott. Tyler Keefe is here. We're going to continue to talk coronavirus. And I guess we can go to him early, Larry. I think I see Dan Miller here. Hopefully we can go to him a little bit early and ahead of schedule because he is standing by. He is the voice of the Detroit Lions and sports director at WJBK Fox 2 Detroit. And Dan, this is, we've not met in person, but this is the craziest thing I've ever done. I've been doing radio for my whole life, and I'm actually sitting here in a TV studio in West Bloomfield doing radio and TV with a bandana on my face. I mean, these are these are crazy times. Thanks for joining us.
Yeah, you think you've seen everything, and then you realize you haven't. And it's, I know the overused term is new normal, but we're all getting used to things that I don't think we'd ever have to deal with. But I think the probably if there's a silver lining here, it's that we've learned that, we have the ability to adapt and do things in a different way. And when challenged to continue to do our jobs, in this case, we can do it. So I think that's been kind of a cool thing to find out. I was just discussing that with some people in our department today. Just, it's beginning to feel normal conducting business this way.
Well, you've been broadcasting from home. I believe you are at home right now. How's all that going for you?
Yeah, I mean, I got sent home probably March 17th, I think. So I've been broadcasting from my house really since then. The challenge has been content, because the normal practices, the normal games, the normal things that we deal with aren't there for us. So we've had to be a little bit more creative. The NFL has certainly helped because they've stayed in business, and we've had a lot of NFL news to deal with. But it's been about, reaching out, talking to athletes, finding out what they're doing. A lot of people, what they're doing to help socially and help, first responders and people in need. So there've been a lot of good stories to deal with, but it's certainly probably the most creative we've ever had to get to fill our time when it comes to this period when we've all been working from home and had to use Zoom or some other method to get people in contact with them so we can find out what's going on.
Well, I really appreciate you taking time to join us on our megacast, as we're calling it, here across a bunch of Oakland County. It's good to talk to you. And I was not really surprised that the NFL draft saw the biggest audience in history. We're all pent up. We're just dying for anything that's new and fresh. And that was a very interesting draft. What are your thoughts about it?
Well, I think we were hungry for something. We didn't know the results going in. It's one thing to sit and watch, Game 7 of the '68 World Series when the Tigers are going to win, or some of these old Super Bowls they've been showing when we all know who's going to win. So most have been watching old sporting events. So I think we were all hungry for something where there was some intrigue and we could be surprised. And I think there was every chance in the world that could have been a technological nightmare trying to do what the NFL, all the broadcast entities, all the players that were getting selected did. And to everybody's credit, it was incredible. I mean, the way that it came off was just such a credit to everybody that was involved with the planning. It was a beautiful broadcast. I think it was a feel-good broadcast in that there was so much family involved. I think it was a feel-good 3 days at a time when we all needed to feel good about something, and I think it surprised even, I think, a lot of the people that were involved. Just listen to Bob Quinn and Matt Patricia. Look, one of the, things about being an NFL head coach or general manager is you don't see your family very much. It's just a fact of life. These guys work a lot of hours. They're there past midnight and they're back at 6 a.m. if they go home at all. And I think these guys kind of found out, we can do this at home and we can still be effective. Now, that doesn't mean that's the way they'll do it from now on, but it's kind of what I said before. When challenged, we adapt. They adapted, and I think they enjoyed it. A lot of them had their kids in there helping with them. You saw dogs running around the place at Bill Belichick's place. No, I think it was really cool. It was well done. And I give credit to everybody that made it happen. And as you alluded to, it was something we all needed.
All right, Dan Miller, play-by-play voice of the Detroit Lions, and, of course, we see him on Fox 2 Detroit. Dan, I know you know how to cut to a station ID during your game, so forgive me for 30 seconds. This is WAHS in Auburn Hills, WBFH in Bloomfield Hills, and WBLD in West Bloomfield, Orchard Lake, and all of our other outlets on the Megacast. So let's talk, Dan Miller, about what the Lions ended up with in the draft. Your thoughts?
Well, I don't think the first-round pick was any surprise. Jeff Okudah had been linked to them for quite some time. He was best cornerback in the draft. So I think it probably would have been a mild surprise if it had been anybody but him. He probably, Derek Brown, Isaiah Simmons, one of those guys wouldn't have knocked you down. But I think Okudah was just the guy that made the most sense. It's a position of need. It is a premier position in this league if you get a guy who's a cover corner and can kind of cut off half the field for you. And it just – at number 3, it made the most sense for them. There's arguments about, trading. Well, there was nobody to trade with. There's argument about quarterback. They didn't want to draft a quarterback, and you got a coach and a general manager. They're kind of in a win-now situation, so they didn't go in that direction. So, I think DeAndre Swift in the second round, a lot of people felt like that was a great value pick. Because he was expected to maybe go in the first round. He didn't. They had their pick of every running back on the board except for one who had been drafted in round 1. So, but Bob Quinn talked about that and said, when they looked at the board after the first round, that was the guy that jumped out at them. And as they went to sleep that night, they were just hoping that he would still be there after the 2 picks before them went. Julian Okwara in the 3rd round is a guy that wouldn't have been there had he not gotten hurt last year. I think he was projected as a first-round pick, maybe a second-round pick, but no way he's there in the 3rd round if he didn't get hurt late in Notre Dame's season. So he says he's ready to go. If that's the case, there could be some real value there in getting him. They need somebody that can potentially do what he does. And let's keep in mind, when you're talking about these guys, all you're talking about is potential because you have to come into this league and prove that you can do it. But they really needed somebody that could come in from the edge, pressure the quarterback because that was really missing last year. They drafted 2 guards, get some competition in that room, let the best 2 guards figure it out and figure out which guys are going to be in that starting lineup. I think both these guys have a chance to start. Another running back. I was told by a coach a long time ago that when you get to the 6th and 7th, even the 5th round of a draft, you're drafting somebody who usually has one trait. They're guys that have holes, but you're looking for somebody that has one trait. Maybe it's speed, maybe it's great hands, maybe it's, an innate ability to just get a guy on the ground and tackle, something along those lines. And I think it's speed and versatility when it comes to Hundley. Then 2 defensive tackles late. Penasini is a big guy who theoretically could be a backup at defensive tackle and maybe a starter down the line. He's a run stopper. Can't have enough of those in this league, and a little more versatility in Cornell, the kid out of Ohio State. So, look, on paper, I've read all the reviews. People seem to like it. Seems to be a draft that checked a lot of the boxes that they needed to check. But the fact is you don't know for a while until you get these guys in here. In theory, it looks great, but ultimately these guys have to prove that they can play in this league.
Well, last year, we take a look at last year. Last year was really disappointing. We had high hopes for last year. Stafford gets injured. Team didn't play at all up to expectations. This year, you got some of those guys that can come back in the coming year and hopefully perform better. Hopefully Matt Stafford's going to be healthy. And then you've got all of these new draft picks. It's easy. I mean, we're always optimistic at this point in the year. But it's easy to look at this and say, we're going to be a lot better off than we were last year.
Yeah, and I'm generally optimistic about any team that I deal with and really probably across the league. I just kind of look and I try to figure what's the best case scenario. But I think what you touched on early there is the most important part. We get so caught up in what happens in March in free agency and April in the draft. The most important thing for a football team is who's already here. The most important thing for a football team is the core that you've already put together. The best teams draft players, put them in a system, and they continue to improve until you look up at one point and say, you know what? We've had enough draft picks. They've had enough time. They're pretty good, and now we're ready to roll. The biggest thing that can happen for this team is that Amani Oruwariye steps up, that Tracy Walker steps up and continues to ascend to look like he's a terrific player, that TJ Hawkinson continues to step up, Ragnow gets better, Decker continues to get better. All the guys that are here, Kerryon Johnson stays healthy, Deshaun Hand stays healthy. It's about the guys that are here. Look, free agents, it's been proven in this league, you don't win championships through free agency. You plug holes through free agency, and rookies struggle. So it's about the guys that are here being better, picking up their games and growing together. And I think that's going to tell the tale of what happens to the Lions in 2020.
Dan, do you think we're going to see football in 2020, and do you think fans are going to be able to be on site at Ford Field?
I only have an opinion. I have no fact, and I have no great information to lead me one way or the other. I do think we'll see football professionally at some point in the fall. I do think they will figure out a way to play. It's tough for me to envision right now 65,000 people. Maybe there's some sort of lottery system where they can just have people spread out through the stadium, but it's not full. Maybe there's no fans at all. I believe they'll figure out some way to play. And look, we're so dependent upon what happens throughout the rest of society. If we have a second wave and a big flare up, then everything else goes by the wayside.
Well, I think it was. I think we had I think we had a really tough time in the NBA. I think what shut the NBA down wasn't necessarily the fans, but it was the players, contracting the disease, and the players are played in such close proximity in football and basketball. How do you think the players are going to react to it? And I guess this is all speculation. I understand, but
no, it is, and there's been talk of restarting the NBA season by quarantining guys, and there's been talk of starting the Major League Baseball season by quarantining guys either in Arizona or Florida, and they'd have to go in there and basically do that hotel, stadium, hotel, stadium, hotel, stadium for 4.5 months to try to fit in a schedule or something like that. I think these are all things that you have to look at. Perhaps we get to a point where we do have, an abundance of testing where you can test guys every week and find out if there's an issue because, to your point, when Rudy Gobert got it, then all of a sudden other guys start having it. Before members of the Brooklyn Nets have it, this thing can spread quickly because you're in close quarters and in a locker room and a clubhouse and places like that where there's really no escaping it. So I think all of it has to be looked at from fans to where the players go, because you can't just play a game and then they go back out in society and then come back and there's no system of checks. I think they're going to have to figure something like that out. It does appear that we're getting to a point where testing is going to get a little bit easier. We're having a hard time implementing it, probably is the clearest indication that we have of what's going on nationally. But I do think probably testing would have to be a part of any sort of return for professional sports. So I think you can apply a lot of what is going on within society, within everyday lives, and within a given state to what may or may not happen in sports. And let's not forget, if you have a team that is in a hotbed area for coronavirus outbreak, it's going to be very tough for them to separate professional sports and their people from what's going on outside that building. So I do think there's a lot of hurdles, but I also think that when you're talking about the kind of money that you're talking about and television contracts and things like that, they're going to do everything they can within reason to make it as safe as possible to play those games. Just a guess. We don't know. We'll find out.
Well, and it's interesting that you say that we'll be following the rest of society on this in football. I'm going to have to go back and look at this YouTube copy of this interview with Dan Miller with me wearing a bandana on my face. So you got to keep it all in perspective at these times. Dan, I've been a football fan my whole life. We get to do, Tyler and I have the pleasure of doing the West Bloomfield High School football games on the radio. We love football. We go to most of the Lions games, and it's tough. It's been tough over my lifetime to hang in there as a Lions fan, and I know there are a lot of Lions fans that it's kind of hard to keep a smile on your face. But then I was thinking about you driving over here today, and you just always seem to be happy. You seem to be very happy doing the games, very positive and upbeat. Does it ever get tough? I mean, if you don't mind sharing, Dan Miller, just between you and me.
Oh, yeah. Yeah, no. Well, I mean, I think it starts with this. This is cliche. I'm living a dream. I was a kid who grew up just wanting to be involved in sports broadcasting. And then when I got old enough to kind of get a press pass and have a microphone, I would watch the play-by-play guys. And when I would watch them walk into the room, man, it was like they were walking on air. And it was just like, and then they would go into the booth. And I thought that was the coolest thing in the world. And I just, I was an 18, 19-year-old kid just saying, one day I want to be that guy that gets to walk into the booth and sit down and put a microphone on and call a game. So at its core, regardless of winning or losing, you realize that you're living a dream. It's an honor and a privilege to have the job. There's 32 people in the world that get to do what I do every week, which is calling NFL teams games on the radio. So that's where you start. Brandy and I, when we went through 0-16, we leaned on each other a lot because that was tough. But the one thing that we always said was, our mantra was, call the next play, because there's always a game happening in front of you, no matter how tough things get. It does get difficult sometimes because you ride the wave the fans ride with this team, and it can get frustrating. And we're no different than the players or the coaches or anybody else who feels it when you're not winning. It's difficult. But I would say the one thing I learned in 2008 was, as difficult as it might have been on Brandy or myself, I was working with coaches that are putting in 100 hours a week. I was working with players that were literally leaving their blood, sweat, and tears on the field. So whatever we were feeling, they were feeling it exponentially more than that, because that's how they defined themselves professionally. And it clearly wasn't going well. So yeah, I absolutely get down, and it's tough. And I've said to people before, the best part of my job, bar none, is when fans are happy. Just that feeling of walking into a gas station and seeing somebody and they're fired up and they tell you about it, or walking into Kroger or Bush's or whatever it is, and you walk in and they're just like, great game on Sunday, something like that. Because the opposite of it is that they tell you how hacked off they are, and that's not fun. But I get it, and it's part of the gig. But there's nothing better than when that team is winning, and the feeling of community within Detroit and the love for that team that is there. But I get the frustration as well. And the job they have is to figure out some way to get past all that, and let's start winning some games and have some fun.
Well, Dan Miller, just, you seem to keep it positive. We can hear in your voice every once in a while when Lions are having a bad day. We can hear it, but you always keep it positive. And you're in a market where, I mean, we love our pro athletes, but we love our play-by-play broadcasters too. You're in a market where I think, look at Ernie Harwell, for goodness sakes. I mean, he's probably one of the most revered people associated with the Tigers. And he never stepped foot on the field with a bat or a glove. So, this is a market where we do love our broadcasters too.
Well, I'm blessed to do what I do, and Ernie's obviously the king, and George with more than 40 years calling the Pistons, and I have such respect for Mark and the two Kens and Dan, and doing the Tigers and Shep and everybody, and it's like it's a great group. It's an extremely talented group to look at those guys and respect everything that they do. I appreciate what you're saying. I wouldn't put myself in the same ever sentence with those guys. Those guys earned it over a long time, and they're amazing. And I was, blessed to know Ernie, and he was very supportive of me, and he sets the tone for other people, not just. And George as well. I mean, to be able to do 40 plus years, but it's not just that. It is that they are supportive of other people. They are happy when they see other people succeed, and they are the kind of people that keep pushing others up and saying, you can do this. And I had people like that in my past. And when I was struggling and wondered if it was going to work out, I had people that would say, you got this, just keep grinding. And I kind of learned from them that I try to do that for other people. So it's, everybody's kind of just trying to find their way, and sometimes you look to them for guidance, not by necessarily always what they say. That helps too, but how they conduct themselves, and you just keep moving forward, and they're great examples of that.
Dan Miller, thank you very much for your time today. Very charitable with your time, and we appreciate it. Good to talk to you. And, hey, look, we're looking forward to what is going to be a great Lions football season if we can get it in. We look forward to hearing your call. And go Lions. I think it was a good draft. Almost everyone I talked to, just fans, my friends, people I talked to here at work, they all thought we had a really good draft. So here's to a great Lions season and everyone's good health, and a big thank you for being with us and sharing some time.
Well said.
Today.
You will get, I appreciate it. You'll get no argument from me on any of those points. I appreciate you having me, and we'll look forward to, if they can give us some sense of normalcy down the line, that'd be a good thing.
Dan Miller, thank you very much. Dan Miller.
Thank you. Appreciate it.
All right, take care. From Fox 2 and, of course, the play-by-play voice of the Detroit Lions joining us right here on the Megacast. A nice little break, Tyler, from, the day-to-day, putting on masks, washing our hands here on the show. And, we are so lucky to have the broadcasters that we have in this town. Dan said yes right away. We'll get Dickerson on the show, too. He's been so nice to me the couple of times that I've met him. But we're really lucky to have some really fine broadcasters, and they're our connection to these teams.
They are, and they're the ones telling us the stories of what are these guys doing while they're out of the off the field, off the court. They're not in practice. They're not getting ready for their season or the playoffs or whatever it may be. Where are these guys? And they're telling us the stories of sports in Detroit when the common person would say there's really not any story in sports in Detroit, and they're showing us that these are regular people too, just like you and I, and they're living their lives, and they're struggling this time too with different things, and sports is their lives just like it is for us in our fanhood. So it's great to get a perspective from a guy like Dan Miller about that and about being a broadcaster in these times.
I'm sorry, I'm just cracking up looking at you and your mask and me and my
it's something.
The thing I didn't get, I forgot to ask Dickerson. I got my notes here, and I just having fun having a conversation. But I'm sorry, Dan Miller. But the this running back situation, I love it. So we got one running back. His name is Carrion. How cool is that? Now we got another running back, and his name is Swift. Do these guys, if they were going to have like fake names, those would be the perfect names for running backs.
Yeah, we just need one that's runner, speedy.
Winner.
Speedy, winner. Yeah.
Winner. All right, we're going to take a break. We'll be back in a couple of minutes. Dave Scott in mask in our studio in West Bloomfield. Thank you for joining us here on the Megacast. In a couple of minutes, we're going to get back on track and talk coronavirus and a little bit of politics as we check in with Michigan State Representative Ryan Berman of the 39th District. It covers an awful lot of our listening area. Thank you for tuning in today, wherever you happen to be. Maybe you're watching on Facebook, on our Civic Center TV Facebook page, or on Civic Center TV online, or maybe on one of our community television channels, Birmingham Area Municipal Access or Civic Center TV, both found on Channel 15 in their respective communities on Comcast. AT&T Channel 99. You could tune in and watch there as well. Just go to the West Bloomfield tab. And thanks for tuning in on 89.3 Lakes FM, 88.1 WBFH The Biff, and WAHS 89.5 Avondale Community Radio. Our Megacast continues in a moment.
Hi, I'm Oakland County Executive Dave Coulter. Our top priority remains slowing the spread of COVID-19 in our communities. Please stay home, and when you must go out to an essential business, take precautions like social distancing and washing your hands when you come home. Because of the pandemic, we are behind in our response rate in Michigan. While you are home, please take a few minutes to fill out the census. It is more important than ever that we receive money back from our federal government. The census is Oakland Together.
The Centers for Disease Control and Oakland County Health Division encourages households to prepare for the possibility of a coronavirus outbreak in their community. Keep extra items in your house for an extended stay at home. Remember any special food items for babies, the elderly, and pets. Keep non-prescription drugs and other health supplies on hand, such as personal medications, at least 1 month's supply, first aid kits, alcohol-based hand sanitizer, at least 60% alcohol, non-mercury thermometer, and get copies and maintain electronic versions of health records. Talk with family members about how they would be cared for if they got sick and what would be needed to care for them in your home. Learn about the plan at your child's school and your workplace. Discuss sick leave policies and/or telework options for workers who become ill. For more information, go to oakgov.com/health or call our Nurse on Call hotline at 1-800-848-5533.
And welcome back to the Megacast. Dave Scott, Tyler Keefe. Tyler, we sound pretty good with our face masks on. I'm surprised. It worked out well.
Yeah, pleasant surprise here, too. We can stay safe and still sound great.
It's hard to see because the lighting, we got to get more light on you over there in the corner. We'll fix it for tomorrow. But very much green and white bandana for the Sparty over there on your side of the studio. Doing well. And thank you for tuning in. We're just trying to do what we can to stay true to the rules that have been laid out by the governor on Friday. She's got another press conference scheduled for this afternoon. More information. Golf courses are now open, but no golf cart. And I kind of get that one. Landscapers, they can do their job. The greenhouses are open. I don't know if you saw them starting to open up over the weekend, but they are. Retail establishments, big box retailers now, you don't have to worry about buying paint or some of the other items that were banned. You can go into the big box retailer beyond the food section, get what you need, as long as you do what we're doing here in the program today. By example, you wear a mask. So you got to take your mask with you when you go out to any enclosed building. And businesses now are being asked to supply masks to their employees, recognizing that it might be a little bit of difficult process right away to turn that on in a day or so. The state attorney general said, don't worry, businesses, it's cool. If you can't get it worked out today or tomorrow, that'll be all right. Employees can bring their own mask, and they should, but try to get it worked out. It is the rule. Now, our governor, Tyler, has been everywhere. She has been all over the media nationally, and every once in a while that happens, and we find out some new information, and that is the case this morning. So this coming from the Detroit News. You can go to DETNEWS, DetroitNews.com, and see this story. Their headline is, Whitmer, next phase of loosened restrictions is possible in the coming days. And reading from the Craig Mauger story today in the Detroit News, Governor Gretchen Whitmer suggested Monday morning that some of the next businesses to see loosened COVID-19 restrictions could be construction and outdoor enterprises. Michigan's first-term Democratic governor made the comments during an interview with Politico. She also said her next move is to alter her previous stay-at-home order, and that could come in the next couple of days. So now that's good news. She's still working on things. And I don't want to step in it in Birmingham where we are on the air. But I'm just going to here's what we saw. There is a home being built in Birmingham, and I'm sure this is not the only situation where this is going on. They had the home significantly built, but they weren't able to finish the roof because the roof construction was suspended when all of this everything got shut down. And so, unfortunately, there's been a lawsuit filed. They couldn't really work it out. But hopefully the governor can solve that problem by updating her order and letting construction workers get out and work on things. And, as you think of things like golf and landscaping, if the construction workers can wear a mask, if I can do a radio show with a mask on, I would think a construction worker could wear a mask of some kind, get an awful lot done, and probably stay 6 feet away. They're working outside, and probably get back to work. I don't see why that couldn't happen.
Yeah, there's got to be a way to make that work safely and to keep them away from other people that aren't going to be on the job. Make sure they have the correct facial protections and hand protections to make sure that they're not potentially picking up the virus or spreading the virus. So it'll be interesting to see what the governor does in the coming days as is being reported in terms of further opening up the state.
So Politico interview this morning, And she'll be back on live today at 4 o'clock. And are we able to get that on the air today live at 4? Okay. So tune in on many of our stations, and if some of our affiliates cannot get the broadcast on, it will be on Civic Center TV, civiccentertv.com. A couple other notes. In a moment or two, we are going to be checking in with State Representative Ryan Berman of the 39th District, and plenty to talk to him about. But here are the headlines we're watching today. The Paycheck Protection Program here in the state of Michigan is back on track. This time they are saying that banks are limited to $60 billion in total funding through the program. So, Tyler, I think where that comes into play, just trying to interpret this at a very grassroots level, it may be that if you are waiting for one of the big banks to approve your Paycheck Protection Program loan, you might want to think about going to one of the smaller banks or the community banks, because it's very possible the big banks have already given out a lot of that money, and it's a $60 billion cap. And that is between the first run and this one today. So talk to your banker, call them up. Whatever you decide to do it today. Do not wait, because that money will be going away very soon. If your business is not open today, you might want to start working on planning to get the masks and get the other things you're going to need. We're going to hear from the governor this afternoon at 4 o'clock, and likely things will continue to loosen up. The one thing that is our next big crisis that we'll be dealing with and talking about over the next couple of days is the budget impact of all of this. We know the state has a lot of financial challenges ahead of them. There are going to, I think I saw somewhere, Tyler, there were layoffs in the Secretary of State's office. That kind of made sense because a lot of those offices are closed right now. But we see this story from Livonia. They have laid off 37% of their employees in Livonia. And I'm not really excited about picking up the phone and talking to the folks in the treasurers and elected officials and mayors and executives in our communities, but I imagine we're going to see some layoffs, varying degrees across our communities here, and that the revenues aren't there. The local tax dollars, the state tax dollars, they are down. So you got to believe that something is in the works and coming in our local school districts and in our local communities.
Yeah, you have to hope that there is, because a lot of the funding currently has been going toward emergency operations for school districts and especially for municipalities, and it's a lot of their budget that's being rerouted and a lot of their funding that's being rerouted to keep the lights on, to keep the services open and running, for educational purposes, to provide for their students and for their staff and faculty. And hopefully it's going to be some sort of relief coming, because we've talked to people on municipal levels, and last week especially notably we talked to Dr. Schwartz from the Avondale schools, who were saying that the budgets are going to take a huge hit, and without some sort of relief, the cuts that are happening now, the program losses that are happening now, are only going to continue.
All right, Tyler, well, thank you very much for that update. We're going to take a break. We'll be back in a couple of minutes. Before the show is over, we are jammed up here. We're going to talk to State Representative Ryan Berman from the 39th District, standing by to talk to him. And we're going to talk to Sabrina Cronin, the founder of Cronin Law Firm, and talk about some of the legal issues surrounding the coronavirus. That and more coming up in a couple of minutes. You are watching and listening to the Megacast on Civic Center TV, Birmingham Area Municipal Access, and WAHS 89.5 Avondale Community Radio, 88.1 WBFH The Biff, and 89.3 Lakes FM. We'll be right back.
Coronavirus is deadly, but Michigan can fight back. Our front doors are the front lines of defense. Staying home is the best way to stop the spread, because just one infected person can give it to 40, who can give it to countless more. So call Grandma, don't visit. Video chat, don't meet up. And if you must go out for food or medicine, keep at least 6 feet from others. Stay home, stay safe, stop the spread.
Hello, I'm Dr. Betty Chu, Chief Quality Officer at Henry Ford Health System, and I'm with Wright Lassiter, Henry Ford Health System's CEO, to talk about coronavirus.
In uncertain times, it's natural to have questions. So I'm going to ask Dr. Chu to answer some of the common ones. First, why can't I visit my grandma to see if she's okay?
Because the elderly are at a higher risk for complications with this disease, and you could inadvertently infect her.
If I'm healthy, why can't I go out with my friends?
The larger the crowd you're exposed to, the higher the chance you could get infected and infect others.
If I have symptoms, why do I have to seek care?
While the disease isn't dangerous for most people, for others it can be. We need to understand how serious your case is, because the right choices save lives. For more information, visit henryford.com or call 313-874-1055.
Hi, I'm Dr. Jonae Caldoun. We know that COVID-19 is spreading rapidly across Michigan right now. The most important thing people can do to protect themselves is social distancing. That means unless you are a critical infrastructure worker or going out to get food or medicine for your home, you should be staying at home. Stay home, stay safe, save lives.
Hi, my name is Kurt Lawson, and I'm the Public Information Officer for West Bloomfield Township. We wanted to reach out to you, our older adults, to provide information that you may find useful during this difficult time. We want to ensure you that West Bloomfield Town Hall, our Waters and Utility Department, West Bloomfield Parks, and our police and fire departments continue to work hard on your behalf. Information and resources can be found on the Township website, the police Facebook and Twitter, or call West Bloomfield Park's COVID-19 Help Hotline. Please remember to keep your social distance of at least 6 feet, wear facial coverings when you leave your home, and wash your hands for at least 20 seconds with soap. These precautions will help keep you safe during these difficult times.
All right, welcome back. It is the Megacast on Civic Center TV, also on Birmingham Area Municipal Access, and that covers Birmingham, Bingham Farms, Beverly Hills, and Franklin, Civic Center TV in West Bloomfield, Orchard Lake, Keego Harbor, and Sylvan Lake, both of those on Comcast, on Channel 15, and then Channel 99 on AT&T. I just looked up at my monitor. I can't help but crack it up wearing this mask. I mean, I don't think we can do this every day, Tyler, but it seemed like the right thing to do today. So we thank you for watching on our municipal television outlets. We also thank you for tuning in on our great radio stations, 89.3 WBLD Lakes FM, 88.1 WBFH The Biff in Bloomfield Hills and surrounding areas, all the way up to Pontiac, and WAHS 89.5 Avondale Community Radio across much of the rest of Oakland County and into Macomb County. So we are doing the best we can to get all this information to you. We are delighted now to be joined by our state representative from the 39th District, checking in via Zoom, State Representative Ryan Berman on the Megacast with us again. Representative Berman, thank you very much for joining us.
Hey, how's it going?
We're doing good. I wish you could see us because we don't have that Zoom video hookup back to our guests. If you would see that we are the first and hopefully only broadcasters ever to broadcast with face masks on. So we're doing the best. We're kind of the studio. It's barely 6 feet in here, so we thought we'd give it a shot today, trying to comply.
Yeah, be careful with that depending on what type of mask you're wearing. I just read a story of somebody wearing one of the N95 masks while they were driving, and it restricted airflow, and he ended up passing out and crashing. I don't know where that was, but I know that is a complaint about some of these masks. Obviously makes it a little bit harder to get that oxygen in there. Also, if you're wearing glasses, it gets fogged up. Yeah, there's little tricks that you have to use to avoid some of those things.
Well, really good tips. See, this is what I love about doing the show, is we get tips from everybody that you just don't see in the public as a whole. Yeah, my glasses have been getting fogged up a little bit. I would never drive with this bandana on, and I didn't think about maybe passing out because I didn't have enough oxygen. Here in the studio, Tyler, if I pass out, will you continue the broadcast in my absence?
I'll have to, yes, I will.
Okay. So, but you don't really have a co-pilot in the car that's going to be able to take over, so really good. We heard from one of our doctors, Dr. Jamie Taweel, earlier, too, in the show. He had another really good tip. He said, don't use your non-dominant hand when grabbing a doorknob, which kind of makes sense because your dominant hand, you might go to your face. So it's just this little stuff. So how about the big stuff going on in Lansing? Representative Berman, on Friday, Governor made her presentation and put a whole new set of orders. Meanwhile, the legislature said, Governor, we're going to take away some of your ability to put these executive orders in place, and legislature passed a provision to do just that. Needed her signature. She's not going to sign it. But you talk a little bit about why we did that and what message you were trying to get across with that.
Well, so what happened on Friday was, in the legislature, you have the upper and the lower chamber. You have the House and then the Senate. And bills can originate through either chamber. And then once it passes one, it has to go through the other. And it has a period that it has to sit for 5 days in one chamber before going to the next. So what happened on Friday is I believe the Senate passed some laws repealing the governor's 1945 Act. It hasn't come over to the House yet.
Okay.
So what the House did is, as I'm a state representative, a member of the House of Representatives, the House, all we did on Friday was passed a resolution. It ended up being a concurrent resolution that went through each chamber to set up a bicameral, bipartisan committee. So it has, I believe, 5 representatives on the committee, 5 senators on the committee, 3 Republicans and 2 Democrats on both. And it's an oversight committee to oversee our government, not just the governors and the departments, but everybody's response to this emergency crisis, to see, what the data was at what time to support whatever was going on, what was done right, what was done wrong, if anything, just to set up this oversight committee. And that's what I went in there and voted on Friday.
All right. Well, I appreciate your clarity on that. And, it gets confusing. I want to go back and, Tyler, what was that It's a Bill song that they did on, was that on Sesame Street? Or
No.
Nope.
It was Schoolhouse Rock.
Schoolhouse Rock, right.
So,
we always got to refer back to Schoolhouse Rock. We try to figure out how it all works. But no,
exactly.
I appreciate your thoughts on that. Do you think, though, getting out of the weeds, Representative Berman, the governor can act essentially unilaterally right now with these executive orders? Do you think that's good? Would you like to see the legislature get involved with a little bit more oversight?
I would. Being an attorney myself, and when you look up our system of government and the reasons that the way it was created, the reasons why, the whole Revolutionary War, getting away from a king, right? And whether it's a benevolent king, a dictator, setting up a system with checks and balances. And that's what we have here. And we have constitutional rights, freedoms. And in our Michigan Constitution, it sets up, you have the legislative branch, the judicial branch, and the executive branch. And no branch should be having powers that properly belong to the other one. What the legislature did in 1945 and then in 1976, and what we're dealing with now, there's these legal examples of how it's translated today into this emergency, is statutorily gave the governor authority to unilaterally act in the case of an emergency, in the case of a riot, an invasion, enemy forces. That was the 1945 Act happening after World War II in case we were ever invaded. And you can't convene the legislature. The legislature doesn't have the ability to act. You have to have some type of continuity of government and give the governor these powers. Whether that's constitutional or not, that's going to end up being played out. It could potentially played out in the courts later this year. But I think it's always a good thing, whether we agree with all the actions of the governor or disagree, just having that ability to have that authority is a little bit scary. It's a little bit scary to a lot of the residents of the 39th district that I've been hearing from. And we're seeing that. And last time I was on the Megacast, we talked about her extension or possibly extending the stay-at-home order. And I brought up some points of, I understand the ability and having to act and, make people and the concern of the safety of our residents, but not when it's logically, invalid of allowing one thing but not another when it's not designed with any risk-based formula or the data doesn't support it. And I started talking about the landscaping, golfing. People can walk on the golf course, but they can't actually, use their clubs and balls. And what we've been seeing that in bringing up these logical inconsistencies and things that don't really make any sense, the governor has just on Friday loosened those restrictions, if you will, for exactly those areas of our business sectors of the economy that we have been bringing up and trying to go from some type of arbitrary essential versus non-essential that originally these orders were set up to whether something can be done safely versus unsafe. And I believe the governor just said this morning, I think she has another press conference at 4 p.m., but this morning in a interview, she even said that it's going to be a risk-based approach from now on. And that's how it really should have been, the whole time. So, we are going in the right direction. And, but that is, having one person, going back to the original question, one person making these decisions isn't what our government was set up for.
Well, I appreciate your thoughts on that. State Representative Ryan Berman of the 39th, impacting our coronavirus megacast broadcast area. I thank you for your thoughts. But just to echo what you just said, you do feel the governor now, with her order on Friday and the leanings that we're getting from today's reports and what she might say this afternoon at 4 o'clock is, you feel she's going in the right direction?
I do. I feel that she's going in the right direction. Again, she said, I know one industry and a couple things that of construction and some other outdoor based industries that are allowed in, surrounding states and isn't here, that we need to start going in this direction. We have to have an exit plan. And the House, I know the Senate brought up a plan. I don't even know what it was. I've been pretty busy to review all these things. I know our own House member, we have a plan, but even with these plans, it's not necessarily, you can't make everybody happy, even everybody in your own caucus and even with your own support, because right here in Southeast Michigan, we have the most amount of cases. We're at 70-80% of all cases are in our tri-county area. And that's what I've been advocating or saying too, is we can't treat the Upper Peninsula the same as we're treating down here. And I think they're going towards, and the governor said, a more regional based approach, maybe updating to the newest federal guidelines, taking this thing, what we can safely do to open back our economy. And while I'm one vote, and maybe I get outvoted where they do a regional approach and it's not necessarily helping the businesses in my district, we're going to be on the right path and the right plan of opening things back up, getting people back to work and doing it safely. And, that's the most important part, because even if we didn't extend the state of emergency, even if the governor said, the data, and that's another thing, the hospitalizations, those are all down. The whole point of the stay-at-home order was to slow the spread of this virus. This virus is always going to be there. It was to make sure everybody didn't get sick all at once to overwhelm our hospital systems. And even here, when we have the most amount of cases in Southeast Michigan, our hospital systems are not over capacity. They are not overrun. Maybe 60%. And we just starting to get more updated data now. And we do also have to be mindful, though, of when we do open everything back up, of that second wave, if you will, or another spike, because it's always going to happen. And we just have to make sure that we have the resources and infrastructure put in place to mitigate that. But going back to my point, even if we said, all right, everything's back to normal today and everybody can go out and do things, we're not going to go back to normal. There's going to be a new normal. I don't think, and you guys there said you're wearing masks, right? Even in the broadcast booth, I see people wearing masks when they're driving. You don't need to wear a mask in your own car. You don't need to wear a mask necessarily, outdoors. It's, in these confined spaces. People have gonna and are changing their behaviors. So the government could say one thing, and it's really up to you to define how you feel and what precautions you are going to put in place, because nobody in the polls are showing, not everybody's going to feel comfortable going back to a restaurant right away. I don't think it's going to happen. I think it's going to be gradual, and just from people's behaviors of walking up, shaking hands, hugging on people. People are going to remain socially distant for a little bit. I should say physically distant for a bit. People are going to be more mindful of wearing gloves when they're opening those door handles, or using your elbow or something else to press a button on the elevator. Because of this shift and these behavior changes, I think we're going to see a big difference in the spread of not only COVID, but any other type of germs and diseases.
Well, State Representative Ryan Berman is with us from the 39th District. We really appreciate him joining us, and I appreciate all your thoughts. And I want to give you time here, because that's what's different about this show. You just can't do this on a 5-minute radio interview or a quick interview somewhere else. So I appreciate you taking time and sharing with us your complete thoughts, and it's greatly appreciated here on the show. Representative Berman, we are now beginning to see the economic impact. News out today that Livonia is going to furlough 39% of their employees. We talked to Dr. Schwartz, the Avondale School District. I mean, he's expecting the possibility they're going to see dramatically reduced numbers. He said like maybe $500 per student in state aid. That's what some of the superintendents were looking at, but we don't know what those numbers look like. You get that. That means fewer teachers in classrooms. We haven't had a chance to talk to our local municipalities yet. We will over the next couple of days. Any thoughts about what's going on from a budget standpoint, and are the conversations beginning, and do you have any idea of what the scope of this is going to look like?
Yeah, I mean, the early projections again, they're just projections. We have to see the duration and again, the scope of how this is going to be, but they're talking about billions of dollars shortfall in our budget. And, and when we're talking about opening back up the economy or going back to business, a big complaint you see out there on Facebook and people mentioning is putting profits over people. And that's not the case. We have to look at the overall picture, and it's not just, a pandemic. It's the long-term ramifications to the mental and physical health of all the residents, including our economic health, livelihoods, work. You're seeing hospitals, because of what's going on in non-essential surgeries, that are the bulk of their revenues, doing layoffs, furloughing employees. And some hospital systems, I just heard in some of the rural areas, are saying we have to start back up, otherwise our hospital will go out of business, and that is going to kill a lot more people than COVID ever will. It's going to be life-sustaining. So you have to think about these practical considerations in making any of these decisions and opening the economy, because without businesses, without jobs to go back to, who is going to support in the hospital systems? Who is going to support the school systems? We won't have the money, right? So, all of that goes hand in hand, and we are going to be facing billions of dollars in shortfalls here. So this budget cycle and negotiating the amounts to different departments and agencies, even the school funds, it's going to be a fist fight between these departments.
Yeah,
and every penny is going to be scrutinized at this point.
I appreciate. I think you put it really well. It is going to be a fist fight, and somehow, getting through all this and untangling this mess is going to be very, very complicated. And we'll leave that one for another day, but it's right on the horizon. And, you know, I'm glad you brought up the issue about outstate hospitals, because that's an issue. It impacts us here, too, because a lot of folks are going to start to travel up north. And if the hospital and the community that we visit isn't there, you know, these hospitals have not been able to do elective surgery outstate, neither of the hospitals here. And as a result, for some of these hospitals that have very little, if no coronavirus activity, shutting down their elective surgery, it's just taking all the money away from them. So, you know, it is a balancing act, and you know, it's important. The economic side of this is important. You said it well earlier. The health side of this is important. So Godspeed to you and everyone in Lansing. Try to figure all this out and sort through it. And thank you for sharing a couple of minutes with us and your thoughts today on our show. Do you have any final thoughts before we say so long?
No, just again, thanks for having me. Always a pleasure speaking with you. I'm available to anybody. Reach out at repberman.com. Call my office, email. We'll help you out, and I'll get through this together.
Absolutely. And thank you for that outstanding advice. Don't wear your mask while you're driving. I don't want anyone passing out on a roundabout in Commerce Township or West Bloomfield. You know, it's crazy. It's the little things you don't think about, right, Representative Berman? It's a little advice that we can be most useful with.
All right.
Thank you very much. He is our state representative from the 39th, Representative Ryan Berman. We're going to take a break. We'll be back in a couple of minutes. This is the Megacast.
Hi, I'm Dr. Faust, the Medical Director for the Oakland County Health Division. The most important thing you can do to prevent the spread of illness is to wash your hands thoroughly and often. Follow these 6 easy steps every time you wash your hands. Step 1, turn on the sink and wet your hands with warm water. Step 2, apply soap to your hands and lather between your fingers, under your nails, and the front and back of your hands and wrists. Step 3, wash your hands by scrubbing them together for at least 20 seconds. Step 4, rinse your hands with warm, clean water. And step 5, dry your hands with a clean cloth towel, a paper towel, or hot air blow dryer. If you're using a cloth towel, make sure to change it often. For handheld faucets, turn off the water using a paper towel instead of your bare hand. Step 6, if you're using a paper towel, throw it away. Practice healthy habits like washing your hands after coughing or sneezing into them to keep you and others healthy. Go to oakgov.com/health or call Nurse on Call at 1-800-848-5533 to learn more.
All right, thank you very much for joining us on the Megacast. Dave Scott, Tyler Keefe, in our Lynx FM studio. And we thank you for joining us on Birmingham Area Municipal Access. Birmingham, Bingham Farms, Beverly Hills, and Franklin on Channel 15 on Comcast. Civic Center TV in West Bloomfield, Orchard Lake, Keego Harbor, and Sylvan Lake. Also Channel 15. If you want to watch us somewhere else and you have AT&T cable at your house, you can tune in to Channel 99. Go find the West Bloomfield channel, and that's where we are. And then on the radio, 89.3 Lakes FM, 88.1 WBFH, The Biff, and WAHS, 89.5 Avondale Community Radio. A little bit symbolic here on the show, I will admit, wearing the masks today, but masks, I don't think we'll do this again because we're just going to get a little more distant tomorrow. When we're walking around the building, Tyler, we're wearing the masks. But when we're on the air, I don't think we need to. But I wanted to be a little symbolic with it today because that's the big issue. We can talk about all the other nuance. The biggest issue for everybody listening today is you got to have that mask. Don't worry while you're driving. That was great advice from Representative Berman. That's too bad. Someone passed out because of oxygen. But do wear it when you go into a store. And don't be afraid to keep that mask with you. And it will help, and it is the law right now here in the state of Michigan. We expect to hear from the governor at 4 o'clock today. And Tyler, governor on Politico with interviews today, other interviews around the state of Michigan. And she implied that she's going to have some news for us this afternoon at 4 o'clock.
Yeah, we'll see what that is. I'd expect more updates, from what I've read, more updates on this current stay-at-home order and maybe some even more loosening of restrictions and more things being opened up as this progressive reopening of the state.
The big issue that I wouldn't be so surprised to hear or talk about today, the one that's really getting a lot of attention and affects the most number of people, I think, is construction. Will she open up construction? We've got, a lawsuit in Birmingham right in our own backyard where, a roof couldn't be completed on a home, and that could do damage to the rest of the home. I'm not criticizing anyone. It's just the way it is. So these kind of things, I think, need to be worked out, and I think we can work that out safely. Hopefully we can. I would really like to hear the governor clarify what's going on with boating, and we can put our boats in the water, but we cannot have a marina like work on our dock or put our boat in the water. A lot of people in our area right here have a boat, and it's being stored somewhere. They got to get it ready. They got to do the engine work and get everything in the water. A lot of us don't do that ourselves, so I would really like to hear. I mean, you can get your car worked on, right? You can get your car worked on, but you can't get your boat worked. You can get your bike worked on, but you can't get your car worked on. So drawing these lines is complicated. I'm glad I'm not the governor, but Gov, if you could get the construction and maybe the boatyards back into business, that would make a lot of people happy. COVID-19 vocabulary, really quickly before we go. We've been keeping up to date on the new terms in our culture as a result of all this. Tyler knows these better than all, like flatten the curve.
Yeah, flattening the curve is an effort to take precautions so that you are not contributing to increasing the number of cases of COVID-19.
And we have definitely flattened the curve here in our area. Physical distancing, not social distancing, but physical distancing.
Keeping a distance of about 6 feet from other people to lessen the chance that you are passing the disease on to them or picking up the virus yourself.
We're finding out that maybe up to 30% or more of us are asymptomatic.
Asymptomatic is when you may be carrying the virus but not be showing any physical symptoms.
New normal, Tyler.
It's how society, it's how life changes due to our experiences during this pandemic.
Curbside testing, and I've got a variant on a theme there, but curbside testing.
Curbside testing is quick and expedient testing for COVID-19, usually done in a drive-through method, and now the results are coming in within about a couple of days.
I talked to somebody who did some curbside testing at Henry Ford Hospital over the weekend. There was no waiting. So, I mean, that's good. How about curbside retail? I don't know what the official wording is going to be there, but that's today a lot of curbside retail happening now.
Yeah, it's going to be a lot of online ordering or ordering in person, and then someone from the store will go in, retrieve your items, and bring them right to your car.
Today, Tyler and I are wearing our face masks while we're on the air. I thought it'd be kind of cute. I thought it would be symbolic, and we have done it in an abundance of caution.
That's taking extra precautions to protect yourself and others from coronavirus.
And the Megacast on our list right here.
Not just a regular broadcast or a simulcast. This is a partnership between multiple media outlets to bring you the information you need to know.
Isn't he smart? I mean, this guy is so smart.
It's a blessing in the curse.
PPE.
That's personal protective equipment. That's masks, face shields, gowns, and so on. Should be reserved at this point for those working on the front lines.
And part of the reason we go through the vocabulary is to make points and remind you some of the things you should be doing in a helpful, friendly, hopefully entertaining way. And we came up with a new one today. One of our guests, Dr. Taweel, came up with let me get this right, non-dominant hand.
Yes, so if you are right-handed, your right hand is your dominant hand. If you're left-handed, it's your left hand, and your non-dominant hand is the other one.
And why is that important for the coronavirus?
Because if you are typically using your right hand to do things, open doors, scratch your face, and so on, if you're touching other objects and you're touching your face, you're more likely to pass the disease on than you are using your non-dominant hand.
So simple and so smart at the same time. And then this isn't really one of our terms. We have to work on this to see if we can clean this up and make it a term. But don't wear your mask while you're driving, said Representative Berman.
Yeah, there may be certain things, and we'll have to do our research on this, that could restrict your breathing by wearing a mask. So if you have issues breathing, it's best to not wear it in confined spaces.
Yeah, well, confined spaces is okay, but don't wear your mask while you're driving because you might have an oxygen deficiency and for goodness sakes, pass out. So we hope that doesn't happen. Hey, that's all we got for today. Thank you so much for being a part of the Megacast across all of our great radio stations. We thank you for tuning in. Thanks to our guests. How kind of John Fitzgerald to check in from the Keego Harbor Police Department. Dr. Jamie Taweel. He is kind of like our, he's almost like our Dr. Sanjay Gupta here on the show. He was with us today. Dan Miller, 20 minutes with Dan Miller, the play-by-play voice of the Detroit Lions. And you see him on Fox 2. He's been reporting from his home lately, and really a great, genuine guy. He has high hopes for the Detroit Lions after the draft, and hopefully we can get some football in before the year is out one way or another. Always good to talk to State Representative Ryan Berman, who joined us just a couple of minutes ago, and we thank you for tuning in wherever you are. We hope you'll tune in again tomorrow. We are here each and every day from 10 until noon live, and then repeats on many of our radio and TV stations across the way. Huge thanks to Lakes FM 88.1, WBFH The Biff at WAHS 89.5 Avondale Community Radio. Thank you to Ryan, one of our producers. He's a producer here at our facility. And Jeff, the executive producer of the Megacast, doing a great job again today. Thank you very much. Thanks for tuning in. Have a good day. That is the Megacast for today.